Thank you everyone for joining me here today while we talk about the cranial nerves. After the completion of this video, students will accurately 1. Identify all 12 cranial nerves, 2. The roles and functions of each nerve, and 3. How to properly screen for cranial nerve dysfunction. It is very important to be able to understand functions in order to diagnose dysfunction. One useful technique for determining the correct order of nerves as well as how they present is with the use of a mnemonic. One I found to be useful was OOO, to touch and feel, very good velvet such heaven. Bearing that in mind, we will begin to write down all 12 nerves. 1. Olfactory, 2. Optic, 3. Oculomotor, 4. Trochlear, 5. Trigeminal, 6. Abducens, 7. Facial, 8. Vestibulocochlear, 9. Glossopharyngeal, 10. Vagus, 11. Spinal accessory, and 12. Hypoglossal. Another mnemonic is, some say money matters, but my brother says big brains matter more. Bringing it back to our list of the 12 cranial nerves we just discussed, we can fill in which nerve corresponds with motor, sensory, or both aspects of function. Now that we correctly identified all 12 nerves, we can learn their proper functions. Cranial nerve 1 is olfactory, which is sensory and important for our sense of smell. Cranial nerve 2 is the optic nerve, which is for our sense of sight and our ability to see. The next nerve is oculomotor nerve, which has motor portions which open our eyelids as well as give us the ability to constrict our pupils. Cranial nerve 4 is the trochlear nerve, being a motor nerve which controls our eye movement and the depression of our eyes. The next nerve is cranial nerve 5, which is trigeminal, which has both motor and sensory portions giving a sensation to our face, as well as motor function to our muscles of mastication, such as the temporalis muscle and masseter. Cranial nerve 6 is abducens, which gives us motor innervation to the lateral rectus, giving us lateral eye movement. The facial nerve is both motor and sensory, which are important for giving us our facial expression. The vestibulocochlear nerve is important for our hearing and balance. Glossopharyngeal also presents with motor and sensory portions innervating pharyngeal muscles, salivary glands, as well as giving us our taste of posterior tongue. The vagus nerve, number 10, is involved with speaking and swallowing. Cranial nerve 11 is spinal accessory, which is primarily motor, innervating the trapezius muscle and sternocleidomastoid, ultimately giving us shoulder elevation. The last nerve on the list is the hypoglossal nerve, as motor, innervating tongue muscles. Now that we know all the functions of 12 cranial nerves, we can put it together and assess for cranial nerve dysfunction. Test for the olfactory nerve, we have the patient close their eyes and we bring something familiar to each nostril to see if they can determine the smell. For cranial nerve 2 and 3, they can be tested together as they both incorporate the eyes. We bring the light source to one eye, and if the contralateral eye constricts as well, this is known as the consensual reflex, and this determines that cranial nerve 3 is intact. The next method of testing includes the H method, which incorporates the cranial nerves 3, 4, and 6. Here we bring our finger following an H pattern and ask the patients to follow with their eyes. If they can control their eyes superior, inferior, medially, that is 3, medially and down for 4, and lateral for 6. To test for trigeminal nerve, we have the patient close their eyes and we touch them on their jaw, forehead, cheeks, and see if they can pinpoint where we touch them, as well as palpating for temporalis and masseter for contraction. The facial nerve assessment includes asking the patient to puff their cheeks, smile, raise their eyebrows, and close their eyes tightly. For the vestibulocochlear nerve, we have the patients close their eyes as we rub our fingers together and ask them to determine which ear they heard the noise. For the glossopharyngeal and vagus nerve, we have the patients stick out their tongue and say ah as we look for symmetrical elevation of the soft palate. Testing for the spinal accessory nerve calls for a manual muscle test for shoulder elevation. Last but not least, for the hypoglossal nerve, we have the patient stick out their tongue to see if it deviates towards one direction. I want to thank you all for listening today, and I hope every student was able to 1. Identify all 12 cranial nerves, 2. The roles and functions of each nerve, and 3. How to properly screen for cranial nerve dysfunction.